Hi there, my name is Ikya Muppuri, and I'm going to be presenting on exploring the treatments for chronic spontaneous urticaria. I chose this topic because my grandma has struggled with the skin condition for as long as I can remember, and she is my biggest role model in life. I remember she would always wake up in pain in the middle of the night because of this condition. And so, what I really wanted to do was research and do something that could contribute to helping her and patients who also struggle with the same skin condition. Okay, without further ado, let's get started. Some context. So, what is CSU? CSU is a chronic inflammatory disease characterized by hives, and it can sometimes be accompanied with angioedema. Angioedema is swelling of the lips, tongue, eyelid, or throat. Different the CSU patients face many different levels of burden when treating the condition. It can be an emotional burden, like for example, I came across a study where patients with CSU were 6 times more likely to experience depression than healthy individuals, according to the study. Also, it can be physically burdening. It can directly impair social or work performance. Many with CSU find it hard to keep up with work tasks or regular productivity with their symptoms. And it can also be really costly to treat because on average, thousands of dollars are spent a year treating this condition. It affects 20% of the world's population, and it mainly affects females and children, and the triggers for it are unknown, hence the name spontaneous. Its counterpart, chronic inducible urticaria, has identifiable triggers such as pressure, heat, cold, etc., but it's not to be mistaken with CSU. Although the triggers are unknown, it's believed to be caused by the activation of mast cells with the release of histamine and other mediators in the signaling pathways. And I'll get into more of exactly what that means in the next slide. Oh, it's not moving to the next one. Okay, okay, got it. All right. So what are mast cells? First off, mast cells are made in the bone marrow and they travel through blood to tissues. So mast cells, when they detect something that's wrong in our body, their primary job is to send signals to other cells through releasing chemical mediators like cytokines and histamine to recruit other immune cells. So essentially, they're our body's alarm system. Sometimes they activate when they shouldn't, from certain signaling pathways going off, for example, and that can cause various complications like allergic reactions, such as CSU. Okay, now I'm going to be going over the treatments that I'm going to be discussing about. First, I'll be talking about approved treatments, and then I'll be talking about emerging treatments. So, approved CSU treatments. The first line therapy for CSU are second generation antihistamines, and some famous examples of this are Zyrtec, Claritin, and Allegra. And what they do is they block peripheral receptors in the peripheral nervous system, and that inhibits histamine release, and it has fewer side effects than some of the other medications that I'm going to be talking about. But many patients don't find complete relief from antihistamines. A 2022 analysis assessing over 500 patients reported that only 16% of them reached complete disease control, and many transferred to biologic therapy. And that's the case among the crowd as well, too. So not many people find complete relief with it, and they transfer to biologics. So the first biologic I'll be discussing is omalizumab. This is the most established and well-used injectable biologic for CSU, and it was FDA approved in 2014. It is a humanized monoclonal antibody, anti-IgE antibody that blocks free IgE antibodies from binding to Fc epsilon Ri receptors on mast cells. Normally, IgE antibodies, which are associated with allergic reactions and parasite defense in the body, when they bind with Fc epsilon Ri receptors on mast cells, that produces a downstream signaling pathway that leads to chemical mediators being released. These mediators cause the inflammation associated with CSU. However, because the monoclonal anti-IgE antibodies block the free IgE antibodies from binding, that prevents the downstream signaling pathway from occurring, and that blocks the symptoms of CSU. This effectiveness was confirmed in many trials, so it is a safe option for many individuals. Another approved treatment is dupilumab. This is not as famous as omalizumab, but it's still an option out there. It was FDA approved in 2025 for CSU treatment specifically, and previously it was in 2017 it was FDA approved to treat moderate to severe eczema. So for CSU, doctors would then prescribe it off-label. It is a injectable monoclonal antibody that blocks the effect of IL-4 and IL-13 proteins, which are cytokines released by mast cells. And it does this by binding to the IL-4 receptor alpha subunit, which is the receptor shared by IL-4 and IL-13 signaling pathways. And this prevents cytokines from signaling through the receptor and reduces the inflammation and the CSU symptoms overall. Now, let's talk about emerging treatments. So, a recent treatment that has been under trial is called remibrutinib, and it is an oral medication which selectively inhibits BTK enzymes. BTK enzymes trigger mast cells to release histamine and other inflammatory mediators, which, as I repeated, contribute to the CSU symptoms. Inhibiting these BTK enzymes could thus reduce such symptoms, which is what the drug does. Another emerging treatment, even more recent, is called barzolvolimab. So barzolvolimab is an injectable monoclonal antibody that targets mast cells with KIT receptors. For context, the mast cells that cause CSU are KIT positive. By binding to the KIT receptors, barzolvolimab inhibits their activity, which leads to depletion of mast cells and a reduced production of mediators. Here, I have a chart showing I have a chart showing patients who reach complete control of CSU and well-controlled state of CSU. You can see that this treatment is really effective in showing that, and this is based on looking at their UAS-7 scores. A UAS-7 score is a tool used to measure the severity of urticaria over a 1-week period. The total score, which ranges from 0 to 42, is the sum of daily scores based on the intensity of itching and the number of hives. So barzolvolimab's efficacy was shown in many recent trials, but what I found most interesting was that in one of the trials I came across, specifically a 2025 double-blind placebo-controlled trial, the most common adverse event was hair color change. 26% of the patients out of the 42 total in the study experienced a change on their scalp, beard, or body hair. So that's something to take into consideration for this drug when looking at it. Now I'm going to be talking about the advantages and drawbacks. So, approved drugs for CSU, specifically biologics, can be really expensive. For example, omalizumab's list price is $5,000 a month for uninsured patients. Insured patients can get coverage based on the medical policy in their insurance plan. For uninsured patients or underinsured patients, they could try to apply for a manufacturer's assistance program where the manufacturer helps pay for the medication by either lowering the cost or giving it to them for free. But patients must meet a really strict criteria for that, and many Americans just don't meet that. So because of this, it's not as easily accessible. And that's the same case for dupilumab too, because the list price for it is $3,800 to $4,000 a month. But an advantage is that they're both reliable for CSU treatment because they have been tested and so widely known across many trials. So they can, because they've been tested and like widely seen across many trials, they are a very safe option and a considerable one for many patients. Now, going to emerging treatments, remibrutinib, an example or an advantage for that is that it is an oral drug, unlike all the other ones that I listed, the other drugs, because they're all injectables. So this could, when administered to a patient, could be easy for them to take, and it could just improve their ease overall. So that is a benefit that patients could look at if this would be approved in the future. For barzolvolimab, uh, a disadvantage is the hair color change. Again, something patients may not be willing to take a risk for. So, key takeaways. CSU is a debilitating condition that greatly affects a patient's quality of life. A variety of treatments offer promising avenues for symptom management, but each come with their own challenges and drawbacks. So, I believe that exploration and development should continue to make the treatment affordable and accessible to everyone. Thank you for listening.
Wonderful. Thank you so much. Um, I just have to shout out how amazing you were at pronouncing all of those drug names. I feel like I get tripped up on Advil. Like that was amazing. You could have like, prescribed them. That was really, really impressive. So thank you so much.
Thank you.
Yeah, I have a couple of questions for you. One is, you mentioned treatment and symptom management. Is there anything that's more of like a cure that people are working on or that even feels like a possibility for the near future?
So that's the thing here. Because chronic spontaneous urticaria, the trigger is unknown, a cure for it is not really on the table right now. And there is no actual cure. Like the closest scientists have got for it is like developing something that could suppress the symptoms. But even with omalizumab, like complete control of the symptoms and stuff, there's always a chance that these symptoms could reemerge. So
Mm,
right as of now, the research is showing that there's not yet a cure for it.
gotcha, gotcha. Yeah, that seems like such a scary part of it too for someone experiencing it, right? Just
Sure.
the total unpredictability.
Yes.
Mm. What was kind of the most unexpected thing that you learned through the research process?
So would can I ask you a question for this? Would
Oh,
you
sure.
say are you asking me about specifically learning about CSU in general, or more so about what I learned through the whole research process?
The latter, the whole research process.
The whole research process. I would say the biggest thing for me, honestly, was how much understanding it took. Like I remember when I was researching on the very first drug that I mentioned, so not the antihistamines, but omalizumab, I was sitting there for 8 hours trying to understand what was going on from the research articles because it's actually a really extensive pathway, and that's what I've described in like my research paper, which I've done separately. But basically, it's just so deep, and I never knew like that's how much time it actually takes to do the research. Because like I look stuff up normally on social media, it's like 2 seconds, you know? But like to understand this stuff like intellectually, it was a crazy like eye-opening experience.
Yeah, that's so real too, because I know, there's a saying, right? Like the best way to learn something is to teach it. And I feel like that's for you with writing your paper too, where you're like, I have to know it to be able to like explain it and like include it in here and like, yeah, just a deeper level of understanding. Totally. I see we also have a question for you in the chat. Um, and I'll just read it out so everyone can hear it. Does CSU occur along with other inflammatory conditions like asthma?
Yeah, so for that, I would say there's always a possibility for that to occur. It's not necessary. It's not like a given that CSU will occur with other conditions like asthma, but it can. It's more so associated with angioedema, which is what I described in my first slide, which is like the swelling all over the skin. So like very frequently it is accompanied by that. But other conditions like asthma and stuff that could occur if like let's say like your throat is all blocked up and stuff, like that could be a complication in the future.
Yeah, definitely. Okay, another question in the chat. What are the triggering factors that you can avoid to try and minimize? Um, any role of like meditation, maybe as a way to reduce triggering?
Yeah, so like I said, the triggers for it are unknown. All we know is that it is caused by the activation of mast cells, which release those chemical mediators. So there's nothing really on the outside that we can do to like minimize the consequences and the effect and stuff because we don't know what's causing it. We just know that something that's causing it is going to trigger like the internal signaling pathways. Yeah.
Gotcha.
And then for meditation, I don't think that I'm not exactly sure how like if that could contribute towards the signaling pathways not going off. I think
Hmm.
that's something that we can look more into.
Very cool. Very cool.